Well, good morning, everybody. This is a specially noticed meeting to consider resolutions granting CARES Act money disbursements related to budgetary and accounting resolutions and other COVID-19 mitigation measures. Because of the pandemic and consistent with the governor's executive orders, this meeting will be live streamed so that all members of the public who wish to listen and observe will be able to do so, and it will be recorded and transcribed. Madam Clerk, would you please call the roll?
Supervisor Clavin.
Here.
Councilman Blakeman.
Here.
Councilman Carini.
Here.
Councilman D'Esposito.
Here.
Councilman Dunn.
Here.
Senior Councilwoman Gooseby.
Here.
Councilman Muscarella.
Yeah.
I'm now going to ask our town clerk to lead us in the Pledge of Allegiance.
All right. Place your hand over your heart. I pledge allegiance
To the flag of the United States of
The
America,
United States of America,
to the republic
for which it stands,
under God,
one nation.
indivisible, with liberty and justice for all.
Madam Clerk, please call the administrative calendar.
There are items 1 through 5 on the administrative calendar.
Just before we ask any board members to be heard, just so everybody knows, as everyone's well aware, the town received CARES funding under the diligent efforts of Senator Schumer. We've utilized that funding in many different instances to benefit and safeguard the well-being of the town of Hempstead residents. To date, because of our teaming up with other entities, we've been able to provide over now 1 million meals through Long Island Harvest, some of those being delivered through Long Island Cares, through the Inn. In addition, we've tested thousands of residents. We've given funds to all of our hospitals in the area, including private and public. We've given funds to the Nassau County IDA, as well as our private and public college institutions to assist them, and as well as helping reimburse first responders and fire departments in villages. The purpose of today's meeting and these items is because of the conversations we had last week with healthcare providers, in particular with Northwell, and that is why we're having this emergency board meeting. Instead of sitting around and waiting, this town board acts, and they act diligently, and I'm appreciative of all the efforts of all the board members. In particular, one resolution will amend with Northwell and expand testing to town residents throughout the town of Hempstead. So regardless of where you live in the town, you will be able to access diagnostic testing. This is essential based on our conversations with Northwell. As everybody is well aware, we see the spiking of the numbers. This is to safeguard all of our residents in every community throughout the town. The second resolution with baseline health management is the ability to provide rapid testing, not only to our town full-time employees, but to our seasonal and part-time employees, regardless if they have insurance coverage or not. This, again, is based on the advice of medical providers who are seeing a spike, and this mobile rapid testing unit can be mobilized and sent around to different areas of the town so we can safeguard and keep the government functions going as we have done during this entire pandemic. And the last one is a grant to South Nassau Community Hospital that will create a mobile drive-through testing facility. This is a wonderful initiative that South Nassau proposed. And I know all the board members are happy and delighted to be able to team up with all these entities and safeguard not only all the residents, but the workforce, let it be full-time, seasonal, or part-time. And, you know, it's worked out well, and I do want to thank the board, again, for coming together today and recognizing the importance of having to do these meetings in this time frame. And with that, does any member of the board wish to be heard on any item?
Mr. Supervisor, I'd just like to echo what you said. I want to congratulate you for your leadership on this. I want to congratulate my colleagues. Increased testing is vitally important to keep our town healthy, and we have great facilities. We're blessed with great facilities such as Northwell, Long Island Jewish, which is located in my district, in South Nassau in Councilman D'Esposito's district where I was born, and I think this is a great thing to do for the public, and I congratulate you.
Any other board member wish to be heard? Great. Councilman D'Esposito, I'm going to ask you for your assistance with, does any member of the public wish to be heard on any of these matters?
There's one person that is here that would like to speak, and that is Diane Madden. Good.
Hi, good morning. Diane Madden, Hempstead. I had a question about number 2. These tests, this is just the rapid test. Does the town offer the more accurate test? I don't know the accuracy of the rapid, but I've heard it's considerably low.
Yeah, absolutely, Diane. Ms. Madden, I should rephrase that. Yeah, we have been providing testing through the summer. We were testing for antibodies late until Northwell and all the other health providers asked us to provide the PCR testing. We have been doing that. We've done that for residents. We've also done initiatives to focus on essential workers throughout the town. And now, based on Northwell's advice, we're pivoting to expanding the testing. But the rapid testing gives the ability for the workforce to be checked. And if they test positive, then they could go for a PCR test. It may not be 100% accurate, but if it can identify any instances when an employee, full, part-time, or seasonal, may have a symptom or test positive, it's to safeguard the workforce.
Thank you for that. I mean, my concern would be, for example, with schools, they're not doing the rapid test because obviously if it's a negative positive, that person will be out of work for 14 days. So there is a little bit of a concern with that. That's why I'm conflicted on why the rapid test for employees as opposed to the more accurate test.
Again, it's just on the advice of the medical professionals who said, you know what, if you could start with a rapid test, if an employee shows some sort of symptoms and you're able to identify it quickly, then they can go for the second level of testing, which would then be the PCR. And I believe the rapid tests are what I believe they are the ones that the colleges are providing. Nothing can be a safeguard of 100%, but at the medical advice of our providers, they said for the workforce to have this mobile rapid testing unit and the success rate of them, they highly recommend at this time, especially with the numbers spiking throughout the New York region.
Does anyone know what the cost of the rapid test is versus the more thorough test?
Yeah, the rapid test can be $200 per test, and the PCR typically is around $100 per test right now. But as the supervisor said, the rapid test is much easier to administer. It's much faster. It has a 90% accuracy rate. The PCR test is a little better. It's like 97%. So if someone tests positive in the rapid test, they would then get a PCR test under the protocols that the medical professionals have established.
Number 4, it mentions a COVID committee. Could someone please tell me who those members are?
Number 4, resolution 30283.
I believe it's number 4. I took some quick notes here, but I believe it's number 4. One of the resolutions mentions
By the town of Hempstead through the CARES Act to fund unbudgeted necessary expenses incurred directly related to the COVID-19 pandemic related to expenditures by Mount Sinai and South Nassau for the amount of $445,967.00. That's all that says.
Okay, so maybe it's on another resolution. Is there a COVID committee appointed by the town?
Ms. Madden, I have an advisory committee of outside sources, and then we have an internal advisory committee for COVID-related expenses.
And that's a private issue, I'm assuming? Is that something I have to foil?
Jonas Della?
Supervisor, these are committees which are looking to examine whether or not there is compliance with the CARES Act. They don't make the determination as to whether or not anything should be
I didn't make that allegation whatsoever. What I am trying to get to is that, as you see in the media, there is a real problem, a critical problem with the amount of feral cats in Hempstead. Therefore, I was wondering if there is anything that can be done if CARES Act money can be used. For instance, there's an organization.
Ms. Madden, right now we're having the conversations regarding the administrative calendar. Do you have any other questions regarding the administrative calendar?
Well, this is an issue, Supervisor, because, and I'm glad you brought it up, because this is why I pled to the board to please offer a miscellaneous portion of all of these meetings, because there are very critical issues that are pending that the board can help with. But by shutting the public out and telling them they could only speak on these issues, and in addition to that, not allowing them to participate today. So is it that you don't want to hear about it? Because there are needs out there, and I asked about a committee so I can contact that committee.
The fact that you're speaking clearly identifies that people are allowed to participate.
Excuse me? People are allowed to participate. They can come to a meeting that was just posted on Friday. But there should be an option for the public to weigh in. There are many, many questions that the public has about these 5 resolutions. So what I'm asking is if whoever this committee is, if they can meet with the board and find out if the CARES Act allows for TNR services or donations to 501c3s that specialize in spay-neuter. And it could help you redeem yourself, Supervisor, because it's become a real problem.
Thank you, Ms. Madden.
Thank you. Happy Thanksgiving.
Supervisor, I don't think there's anybody else signed in to speak.
Great. May I have a motion on the administrative?
That was not plain to me. Is she talking about the PPEs, or is she talking about the areas over here in my area in particular where residents are not being tested? I misunderstood what she was saying.
No, she was not making reference to that, Councilwoman. That's why I said that these expansions are going to be eligible for all the residents throughout the town, especially as hardest hit areas, and particularly in your cosmetic district, that we're going to do awareness so the residents can know to go down to either the rapid testing site, if they're an employee or in any way, or the drive-through facility, or one of the Northwell facilities that we work so closely with to make sure the locations are in the hardest hit areas of the town.
Oh, okay, because I know we have been testing them. I used my church for one of them, and many of the churches around in the area we have used for testing.
Supervisor, I don't think there's anybody else signed in.
A wonderful job of helping identify and making sure these testing facilities are exactly where they need to be. You're an incredible advocate for your area, and I'm glad that you've been very outspoken in making sure that every area is equally treated, if not a particular focus on those areas that are testing and are harder hit. You've been dynamite in making sure not only for testing, but for food banks as well. So may I have a motion on the administrative calendar?
I'll move it in its entirety.
Second.
Supervisor Clavin?
Aye.
Councilman Blakeman?
Aye.
Councilman Carini?
Aye.
Councilman D'Esposito? Councilman Dunn?
Aye.
Senior Councilwoman Gooseby?
Aye.
Councilman Muscarella?
Aye.
May I have a motion to adjourn?
Second.
Supervisor Clavin?
Aye.
Councilman Blakeman?
Aye.
Councilman Carini?
Aye.
Councilman D'Esposito? Councilman Dunn?
Aye.
Senior Councilwoman Gooseby?
Aye.
Councilman Muscarella?
Aye.
I wish everybody a happy Thanksgiving. May you and your families be safe, and thank you once again for all the work getting it done together. Thank you, everybody.
You too, Supervisor. You too, Senior Councilwoman.
Happy Thanksgiving. Okay. So, hey, please. Tommy.
Who's the data office? Why don't we have one student? Patricia Goldman. Do you know her?